our continuing Bill of the Month partnership that we have with Kaiser Health News and NPR today examines unexpected medical costs. So this morning, we're focusing on the cost of the coronavirus. A Denver father told us he was billed for thousands of dollars in medical charges after an ER visit for coronavirus-like symptoms.
I would have coughing fits that I'd be trying to carry my son up the stairs, and I had to sit down and I couldn't make it up the stairs.
In early April, Timothy Regan went to Denver Health Hospital. He got an electrocardiogram and a lung x-ray, but was not given a nasal swab test. In a statement, Denver Health Hospital said at the time of Mr. Regan's visit, it followed CDC recommendations and was only able to test individuals for COVID-19 who had severe respiratory symptoms. The hospital says Mr. Regan's symptoms did not meet the requirements for a COVID-19 test. Regan was presumed COVID positive by an ER doctor and self-quarantined. And after a couple of weeks, he started to feel better. Then the bill came.
We've never really seen a bill like that, so it took us completely off guard.
That bill totaled more than $3,200. His insurer, United Healthcare, covered part of his bill. But that left Regan owing more than $2,200 in out-of-pocket expenses.
It hit us it was basically a slap in the face when we got the bill.
But on March 18th, before Regan's hospital visit, Congress passed the Families First Coronavirus Response Act. That requires health insurers to waive cost sharing for coronavirus testing. Several major insurers are also voluntarily waiving copays for coronavirus treatment, including United Healthcare under most plans.
It felt like United Healthcare would not live up to their end of the deal unless we held them accountable.
United Healthcare has reviewed Regan's case at the request of Kaiser Health News. And in a statement to CBS News, United Healthcare said this: "We reprocessed Mr. Regan's original claims after reviewing the services that he received. All cost share for that visit has been waived." So that's good news. Joining us is Dr. Elizabeth Rosenthal. She's editor-in-chief at Kaiser Health News. Good morning to you, Dr. Rosenthal. So why did the Regan family get billed this much to begin with?
Well, Congress and insurers have made all of these promises to waive copays for treatment and testing, but we're hearing that's not always the reality. So what happens is, in his case, no one wrote COVID-19 on the coding, right? So that when the insurer is processing the bill, they don't see COVID-19 code, so they think, oh, just an ER visit. Now, there's plenty of blame to go around here. So, sometimes we feel like it's intentional, sometimes an oversight, and it's often hard to know because an insurer can, in some ways, rightfully push back and say, oh, that was just an ER evaluation. Well, he didn't have COVID, or there was no COVID test done. Hence, here goes thousands of dollars to the consumer, and that's just not right. It's kind of breaking promises to me.
Well, thank you to Kaiser Health News for pointing it out, to say, hey, you guys sure don't you want to look at this bill again? And they did, and then decided, okay, this isn't the right thing to do. What do you say to other families that may find themselves in this position?
Well, I'm saying that you should fight these bills. Right, and you have a leg to stand on, right? My insurer made a promise to me. It's largely just a kind of coding loophole that his care wasn't coded as COVID-19 because he didn't have the test and therefore didn't qualify for that actual code. So what I'm telling everyone when they go to the emergency room, the first thing is to say, make sure you put COVID-19, suspected COVID-19 on the chart, and then you have a leg to stand on, and you should fight it. The other thing that we see a lot, because we're seeing all different kinds of manipulation with these bills, is people do the right thing, as Tim did. You call the hotline first. They say go to urgent care. Urgent care says, well, we're not equipped yet to test for COVID-19. Go to the ER. And then you're stuck with all these huge ER bills, which were the brunt of his bill.
Yeah.
He probably didn't need an emergency room, but he had to go there in order to get checked for COVID, and that's not right either.
All right. Yeah, it doesn't sound right, but it does sound like they've rectified it. So again, thank you to Kaiser Health News for stepping in.